All right, well, we're just going to get started here this morning. Michael Rafferty, the CEO of New Detroit, is joining me to kick everything off on this Thursday morning. Michael, it's good to see you. I know you haven't been here since 2019, and it's kind of a reopening and a reconnection with people 2 years after the pandemic, or kind of, I think we're still moving through the pandemic. But what have some of your connections been so far in conversations with people?
Oh, it's been, well, for starters, first time back, like you said, since 2019. It's a bit, it's culture shock,
I think
re-entry
so.
shock, that sort of thing. So it's been nice to see people who I haven't seen in years and who I've known for decades. So that's outside of the two-dimensional Zoom space.
Yeah.
But because there's been a lot of change in policy and leadership across the region over the last couple of years, it's really nice to get to know sort of the freshman class of folks. So yeah, it's and I got to say I started realizing yesterday that sort of the extroverted muscle can get atrophied.
You're not used to it. Exactly. You've got to work it back up again, right?
Yeah.
Yeah,
Sure.
it's very interesting. But you're up here and with New Detroit, and New Detroit is a longtime organization that it works on racial equity and understanding. And there have been a lot of sessions up here talking about diversity, equity, and inclusion. But I think some of the work is really understanding that there is a problem coming out of the last 2 years and looking at the disparities in healthcare in between communities. And we've seen the rise of white supremacy in this country. And we're really at this point where so many forces are converging at once. And when we talk about making big decisions about how to move Michigan forward, race and understanding is right there at the foundation of it.
Absolutely. Michigan and Metro Detroit are great examples of innovation, great examples of diversity, and also great examples of where we have a lot of problems and a lot of work to do across the country and globally, quite frankly, around things like racism. And I'm really happy that there are people like Sandy Pierce who really do take this seriously. And there are business leaders who have really been focused on not just the moral imperative around creating equity, but acknowledging that there's a business case too, and it's a win-win if we address some of the issues that are facing us.
So what are the conversations that you're having right now, and even just addressing that? Look, we have a problem, and we have bias, and when we don't get to the root of this, and we don't actually admit it, and feel that we're in a safe space to say, gosh, yeah, maybe I have made some decisions or unconsciously or consciously that have affected people, and I haven't helped diversify my workforce, and I haven't been part of the solution. It's okay to have those conversations.
Absolutely. It starts with the conversations.
Yeah.
First, it's important to acknowledge that racism is systemic. It isn't just the symptoms where you see disparities in income and wealth, in education, attainment, in health. It's like metastatic cancer, right? And when you think about how Michigan and the rest of the world, are layered, quite frankly, it starts we're people, individuals, right, who come together interpersonally, and it exists. Racism exists in both layers, then institutionally, and then systemically. And the only way to really address that systemic issue, that multi-layered space, is to start with the acknowledgement: I'm a human being and I have bias. I'm a human being and I have opinions. These opinions can negatively impact the person I'm speaking with, and they can negatively impact the systems that I'm in charge of. And fortunately, again, back to some of the leaders that I've spoken with here, a lot of them are open to that kind of conversation now. I think one of the things we have to do in 2022, having come from 2020 and 2021 and seeing disparities in health. I mean, 40% of the deaths early on were black Michiganders, and when we make up 14% of the population. That kind of acknowledgement, should be eye-opening, but it shouldn't be something that gets less attention over time. It shouldn't be something that ends up getting replaced by another flashpoint moment in the media.
Right.
So, one of the things that I think 2022, all of us should be doing, isn't looking at 2020 as history. It's happening now, right? And continuing the conversations is important.
So tell us about some of the programs that New Detroit is working on right now, and some of the initiatives, and what you'd like to see happen in the next year or so.
Yeah. So we have taken a multi-pronged approach in the last couple of years, trying to be bolder. For a long time, and still the mission of New Detroit is to create race equity in Southeast Michigan. But you realize you can't create a solution in one small geography when it's a global issue. So we have begun to partner and develop networks across the country, and we're moving ourselves into having opinions on race and racism globally. We have statements and opinions about what happened in Buffalo and what needs to happen around gun control. Right. So policy is something that we're really deeply committed to and interested in. Aside from doing research that sort of identify the problems and identify the solutions, we realize we have to change hearts and minds with that information. So it can't just be research sitting on a shelf.
Yep.
So putting the information out there that lets people know not only this is where we are, but this is where we have to go is part of it. Using that platform of changing hearts and minds to advocate for policy change is definitely part of what we do. But once you change hearts and minds, it's almost like, as a doctor, you can't just say to somebody, you're sick, and walk out of the room. You have to give them a prescription.
An action plan, or
exactly.
something. What can you do, or how to be part of it?
Exactly. Here's the intervention.
Yeah.
And if you need help getting across the street, here we go, right? So we've been building curricula. I'm very happy to say that we're soft launching the Just Institute, where we've built out a series of intervention tools based on verticals. So Just Care is for healthcare. It's not just bias training, but it's acknowledging that when you as a patient go into a hospital, all of the people who you interact with, all the way up to even those you don't, the billing department and governance, the board members, your care is going to be based on what their opinion is of you. And so we've built this intervention out for healthcare professionals that we hope is going to end up making hospital systems not just more welcoming, but more equitable and more just. Same thing with health or with hospitality and retail. We built something called Just Place to make public spaces more welcoming. And the hope over time is to have as many verticals as possible within this Institute of Services.
It's a deliberate and a conscious choice on the part of business and hospitals. So you talk about hospitality to engage in this way. And I'm so glad that you're able to be up here and talking with people. You also, New Detroit, you're going to be having the first annual Racial Equity Conference.
That's right.
Tell me about that and the power of getting together on that.
So, having come to Mackinac as long as I have, I realize that this type of confluence of people can be very powerful, and we realize that a lot of organizations like ours have annual events, but we wanted to intersect just a gathering of people with our mission. And this October 13th and 14th, we'll be inviting folks from across the country to come to Detroit and understand our responsibility and what we should be doing to achieve race equity. It's going to be a group of well-respected and well-renowned national experts and leaders on various topics of, the intersection of race and healthcare, race and the economy, race and education. So I encourage you to take a look at our website and our social media for more information on that. But we'd love to see as many people as we can, because we all have a responsibility here, and I think it's an event like that helps us understand where we are and what we can do.
We absolutely do, and of everything that has happened in the country over the last 5 years, and here we are in 2022. Kind of give us a sense of what you hope and what you think that we have the opportunity to be able to do at this time.
So when I look back over hundreds of years, I see hundreds of years of oppression. I see hundreds of years of lack of equity. But I also see moments in our history when I don't look at race and racism where I see major leaps forward that happen very quickly when the right motivation is there and when the right investment is there. We got to the moon very quickly when we said, let's do it. Mm-hmm. So when you say hope, I've got this very deep hope that my children, I've got a 5-year-old and a 10-year-old. My hope is that when they're my age, they haven't inherited racism. They haven't inherited this challenge and this problem. That might sound, a little bit, too forward thinking.
It does.
Especially given the history we've got. But that's my hope. But just like how we got to the moon, we have to take it very seriously. We have to be very intentional about it.
We have to do the work.
We do.
All right. Michael Rafferty, CEO of New Detroit. Thanks so much for joining me. It's good to see you.
It's great to see you,
and we
too.
look forward to seeing the conference in the fall.
Thank you.
Okay.
Thank you.
All right. And we'll be right back. Stay with us.